On yesterday's show, the statistician Jamie Jenkins was here to take issue with some comments I'd made about the efficacy of the COVID vaccine's so-called booster. We had a very civilized disagreement, so civilized that Mr. Jenkins posted it on his YouTube channel, after which YouTube immediately removed it on the grounds of misinformation. Perhaps for his next trick, Elon Musk could buy YouTube. As I complained on the show that originally caught Mr. Jenkins' eye, thanks to our awful groupthink media, we live increasingly in a world in which there is only the official version on the one hand and on the other disinformation. So your freedom of speech is the freedom to be a pet shop parrot, and everything else the woke-talitarians of social media will take down. We need a much wider range of public discourse. Our present arrangement, in which there is only the official narrative and disinformation, would be laughable were it not for the fact that its consequences are tragic. On GBNews, we don't do the groupthink. The entire Western world, except Sweden, has lived under a weird experiment these last 2 years. And that experiment has had consequences. A couple of weeks back, I referenced the Ofsted report on the damage done to our children by the years of lockdown and isolation. This is mostly in terms of stunted educational and social development. I'm slightly amazed at how little coverage that Ofsted report got in the media, even though Ofsted is Ofsted, so it's all super official. Many years ago on Broadway, I saw a Sam Shepard play about a dysfunctional family that's got a dead baby buried in the backyard, but everyone's agreed not to talk about it. The Western world's getting a bit like that. The damage done to our kids doesn't matter because we've agreed not to talk about it. And indeed, the control freaks of social media won't let you talk about it. We now have, in addition to the Ofsted report, a bizarre and terribly serious physical ailment that's emerged in a dozen developed nations. Child hepatitis at about 4 times the usual rate. Very unusual. It's in Western Europe, America, Israel, but the epicenter is the UK. We account for about 2/3 of all cases reported to the World Health Organization. In fact, England alone accounts for about half of all cases worldwide. But it's spread from England to Wales to Scotland to Northern Ireland, and in compliance with the Northern Ireland Protocol, crossed the border effortlessly and headed south. Here's the Daily Mail's map of where it currently is worldwide. Take a look at that. America, Belgium, Spain, Israel. What do these countries have in common? Well, some of the toughest COVID regimes of the last 2 years. And as the Telegraph says, deadly outbreak of children's hepatitis linked to lockdown. Infants may not have been exposed to viruses because of restrictions during pandemic, says UK health chief. 1 child is dead, and 10 UK children have had to have liver transplants, which is an awful thing to have to undergo at that age. We don't know why this is happening, and there is as yet no official version of events, so we are free for the moment to talk about it. As a matter of fact, we asked someone from the HSA to come on the show, because if you're going to have a government bureau called the Health Security Agency, this would seem to be a matter of health security. But they demurred. However, we do have Ros Jones, who's a retired consultant paediatrician and who served on the Education and Training Committee of the Royal College of Paediatrics and Child Health, and we appreciate her joining us. Ros, this came out of the blue just a few weeks ago. What do you think lies behind this? Because whatever we're up to now in the United Kingdom, 114 is rather a lot of children with hepatitis.
Yes, absolutely, Mark. And it is worrying. I mean, I think it's particularly obviously worrying if you were the parent of one of these children, because it clearly is a serious infection with this much higher than expected risk for going on to liver transplant. But I wouldn't want the majority of parents to be hugely worried, because although the rate has gone up enormously, hepatitis in childhood is rare. So we're talking about more than rare. So it's still rare. It's just, instead of being very rare, it's just rare. So we've had 100 cases in a population of, 5 million under fives. But it still means one has to look at why. And the UKHSA's suggestion that this is about so-called immune debt, the fact that for the first 2 years of the lockdown, these young children who are very much at the beginning of their own immune career, let's say, have not been exposed to the sort of germs all around that they would have been that helps develop their own immune systems. I mean, I think there's still quite a question mark as to precisely the cause of it. The most likely contender is an adenovirus, which is a common virus. And, normally in small children, it gives them a snuffly nose, maybe a sticky eye, some glands in the neck, but it doesn't give them hepatitis. It is linked to hepatitis in adults with immune deficiency, for example, post-transplant patients, people on chemo might get this.
Right.
But for children, it's very odd for adenovirus to do that. So the worry was that maybe this is an adenovirus new variant, which is much more severe. But that doesn't seem to be the case, because if that were the case, this hepatitis would be across all age ranges. There's clearly a lot more adenovirus around at the moment than usual, about 3 or 4 times as many cases per week. But what's different is not that, but the fact that these under fives are getting this much more severe version of it. Maybe there's a genetic link. They're looking for any other cause, such as a poison, or, obviously the worry was, could this have been vaccine related? But this is an age group that haven't been vaccinated, so it seems extremely unlikely that this is vaccine related. Or COVID related. But again, the incidence of COVID in these kids seems to be no higher than in the general population. Obviously, if you test every child going into hospital, some of them will be positive. But the main linking feature seems to be this adenovirus.
Well, when you say it's not vaccine-related or COVID-related, just to go back to the point you were making earlier about people with suppressed immune systems who just recovering from a serious operation or whatever medication we're on, until 2020, children spent the first 2, 3, 4, 5 years of life running around playgrounds with a lot of other children, or being in the nursery with a lot of other kids, passing germs back and forth to each other all the time, like in a giant petri dish. And now we have done, the last 2 years, we've done something completely different to them that we haven't done in the course of human history, I don't think, which is to wall them off all on their own, cover them up. They're seeing fewer people. They're not passing germs back and forth. And as you were saying, they may well have made them vulnerable to something that you'd previously have to be a 59-year-old adult who's just had a major operation to be susceptible to.
Yes.
You're a lifelong.
And it's interesting because I work with the Health Advisory Recovery Team, HEART, and we covered this in last week's bulletin. But we looked back to what we've written in March 2021. When we did a complete review of pandemic policy. And this was one of the specific things we'd highlighted there. And there have been other publications back from June 2020 highlighting this as a potential risk. And it's been shown with some other conditions too, like there was a quite a severe outbreak of RSV, which is a virus that gives bronchiolitis, respiratory infections in, again, infancy. And was much more severe in New Zealand and Australia, where they had really, again, totally closed the borders and had very, very tight draconian lockdowns. And this adenovirus, it's partly a respiratory virus, in which case, like COVID, it will have escaped masks and lockdowns and everything else, because airborne viruses aren't very well controlled by these measures. But it's also probably a gut virus, it can be passed on by the so-called fecal-oral, sorry, I don't want to go into too much gory details, but, poo's in your mouth, which is what, of course, toddlers do. They scratch bits they shouldn't, and they then poke their fingers in their mouths, etc. But all of the hand washing in schools may have had quite an impact on, reducing the amount of other gastroenteritis things. And I think
that's interesting.
I think it's interesting that it is the UK HSA themselves who have highlighted that this may have been due to lockdowns. This isn't lockdown skeptics saying this. This is the official channels saying, we think. This would explain why it's just this age group. Because if it was a more nasty version of adenovirus that had somehow mutated, then it would affect older children or adults. But it does seem that in the UK, certainly, virtually all the children are under 5. The average age is 3, I think. But in terms of reassuring parents, it still is rare. You'd be your child would be very unlucky to get this. And the only general advice I would give is, obviously, if your child gets jaundice, if they're yellow, do seek urgent advice. But if they're generally unwell, if they've got diarrhea and vomiting, most kids bounce back after 24 hours. But if they're just not getting better, then it will be worth asking. But what you shouldn't do is send them back to nursery until at least 48 hours, after they've finished having whatever, they've had in terms of gastro symptoms, because that's where it's otherwise going to be just spreading around nurseries.
Just let me ask you as a paediatrician then, though, if you have... and as you've said, this remains a rare disease. We're talking about 114 children out of a population of about 5 million. Although there are people who say it's obviously higher, that people just haven't put together the yellowing skin of their kid and the colour of their stools to stray into the matter you were talking about. But let me ask you this: that we've given these kids such a weird 2 years, and we've clearly done some damage in terms of just the normal build-up of your immune system. In some ways, the first couple of years, the first 2 to 5 years, are your most important years of life. If you screw that up, you spend the rest of your life trying to compensate for what you got wrong in the first 3, 4, 5 years. So do you think this suggests that there will be other emergent problems that these children with these very weird, abnormal last 2 years will eventually be on the line for?
Well, I would hope that their immune systems will catch up, but we don't know that. I mean, I think, it is as a vital time in your immune function to be learning early on how to deal with all the viruses and bacteria you're going to meet. So it is a worry. I think, it's more likely, if we look statistically, that the serious things which you alluded to at the beginning in that Ofsted report, in terms of the psychological impact, the fact that children are reaching primary school with very poor language, their normal ability to talk and communicate, because they've been either not going out to socialise in preschool toddler groups, or if they have, they've been with adults in masks. And the idea of wearing masks in any preschool environment was clearly, likely to be damaging. So I'd be more worried about that. But, you're right. I think there's a big question. It's been one of the things that I've been worried about reducing the age range for the COVID vaccines, because the COVID vaccines clearly do have an effect on immune function. And what you want children to do is to develop natural immunity, which will stand them in good stead long term. This, I don't know. Time will tell. And of course, they still haven't finished the investigation.
Yeah.
But I think it seems likely it's going to be an adenovirus which hasn't got worse than usual. It's just that the children are less able to deal with it than usual. And I'm sure lockdowns almost certainly will be a part of that.
Well, as you say, and your stuff from whatever it is now, March 2021, so over a year ago, is well worth looking at. Because I think we can talk a lot about unforeseen consequences. But I think this is certainly something that any paediatrician would have foreseen. This is such a bizarre way to bring children into the world. And as you say, there's no reason for them to be wearing masks for the first. And then you say, you've got weakened immune system, so you're now getting the hepatitis. But we're still going to insist that you be vaccinated if your mum and dad want to take a holiday in Spain or the south of France. It's bonkers. It's sick. And until we have an answer to some of this stuff, there certainly ought to be put on hold the idea of jabbing primary school kids. Thank you very much, Ros. We appreciate your insight, and it's good to hear it from a paediatrician. Let me know what you think. GBViews at gbnews.uk. You can tweet me at GBNews.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.